This story is about a lot of things, but to us, it's about raising an awareness of cardiac events, which happen every day in so many different places. Please support funding for AED and CPR training, especially in underserved communities, as well as the need for athletic trainers in youth sports. If there is one thing we hope you take away from this tonight, learn CPR and how to use an AED, because they save lives. The response to Damar's injury was able to bring our nation together for a moment and show the world the power of prayer. Let's remember that feeling of unity and use it to make sure we can save the next life too.
Reports came out this morning that Bronny James collapsed on the basketball court yesterday and suffered from cardiac arrest. We're going to be discussing the medical side of this topic and what could have gone wrong. And most importantly, we've gotten good news that Bronny is currently in stable condition. When we say someone suffered from cardiac arrest, that means that their heart stopped beating, and subsequently that led to failure of blood to pump to the brain and the other organ systems. Typically when cardiac arrest occurs, someone could get dizzy, they could get lightheaded, and eventually they're going to faint because they're not getting blood to their brain and the rest of their body. So you'll see this moment of collapse or loss of consciousness. Anytime we're evaluating anyone who's passed out, one of the first things you think of is cardiac arrest, because that's one of the most fatal things that can happen. You might have heard about the ABCs, airway, breathing, circulation. So when someone collapses, one of the first things to do is to see if they're arousable and to see if their airway is open or patent, and then to assess whether they're breathing, and then to check for a pulse to see if their circulation is intact. Now, if the circulation isn't intact or you can't sense a pulse, that's a sign to start CPR. In basic life support, if someone doesn't have a pulse, you call for help and then you start doing CPR or cardiopulmonary resuscitation. Cardiac arrest is when the heart stops beating, most commonly from an arrhythmia or abnormal electrical activity. They can be caused by a number of different things, which I'll discuss later in this video. So the act of CPR is intended to press on the chest to allow the heart to squeeze and get blood to the body. The ultimate thing is then to get an AED or an external defibrillator to the person as quickly as possible to apply an electrical charge to reset the abnormal rhythm to get that heart beating correctly. There's so many things that can lead to cardiac arrest, and many of them have nothing to do with the heart in general. And we're going to be discussing some of the most common things that happened and other things we've seen in sports in hopes that you learn something new and in hopes that this raises awareness for how important CPR is. Something we often see in the ER and hospital is called syncopal episodes. This is when someone passes out and we aren't 100% sure what could have caused it. Once the patient stabilized, the first thing I begin working up is heart-related issues, electrolyte abnormalities, and checking the volume status of the blood. Hypovolemia is common in athletes due to dehydration, checking their blood sugar to make sure they didn't have any hypoglycemic episodes, ruling out possible seizures, evaluating their lungs, and if they're able to get oxygen into their blood without assistance, and consulting specialists like the cardiologists and neurologists to get their recommendations for further workup, as well as their expert opinions. Heart-related conditions that we've seen in athletes in the past include but aren't limited to genetic conditions someone might be born with. We've seen this with Hank Gathers in 1990, Reggie Lewis in 1993, and more recently with Sharif O'Neal. Another thing to consider is commotio cordis, a rare but potentially fatal condition where a sudden blow to the chest can trigger a lethal heart rhythm disturbance, something we saw recently with Damar Hamlin. Myocarditis, which is inflammation of the heart muscles. There's a plethora of other abnormalities when it comes to the electrical rhythm of the heart, and the electrophysiologists, which is a subspecialty in cardiology, are typically consulted to be able to give assistance in this area. That's it for the video today, guys. Thank you for tuning in. My heart goes out to LeBron, Bronny, and their entire family. This is a moment for us to acknowledge the medical response teams involved. Typically, if the brain doesn't get oxygen for 3 to 5 minutes, you can have permanent damage. And it just goes to show how important learning CPR is for our family members and for our athletes.